Well, good afternoon. I'm very happy to be here with Commissioner Briones and Congresswoman Sylvia Garcia, and we just realized it's the first time the three women who've been elected to Commissioner's Court have been together in this building, and so I'm really proud to be with you guys and really thrilled. I want to acknowledge also Chief Philip Bosques, who is Assistant Chief of Detention at the Harris County Sheriff's Office and has been a key leader in this initiative, as well as Dr. Jamie Hughes. She is the Division Director of Access Harris County at our Harris County Public Health Department, another leader in this program, as well as Alex Lowe with the Office of Justice and Safety at Harris County. Since I've been in office, we've been fighting crime in Harris County by investing in smart, evidence-based strategies, not just solutions that sound good, that people are going to cheer us for, but that aren't actually effective. I'm proud that our approach is already showing success. Violent crime is down 10% in Harris County over the past year, but that doesn't mean the work is done. Ultimately, we want everyone to feel safe in their community, in their homes, in their businesses, in their person. That's what we strive for, and we're going to continue working. And that's why today we're unveiling yet another evidence-based strategy to reduce crime and reduce recidivism in our community. I'm proud to announce we're investing a historic $4.7 million in American Rescue Plan funding to create the Women's Reentry Program at the Women's Center Jail. Now, before I explain the program, I want to acknowledge Congresswoman Garcia, all of our members of the Harris County delegation who voted for this program, for the American Rescue Plan, as well as the Biden administration. Congresswoman, there's so much we couldn't do without your support, and this is just one program of many enormous programs, from early childhood education to environmental protection to housing, you name it. That's come because of your support. Today's initiative will help incarcerated women re-enter society successfully. That will reduce recidivism, reduce crime, and cut the cycle of incarceration. It will not only help the women, but it will help the entire community because, of course, all of those social family ties that women have. Increasingly, there's a high rate of incarceration among women, and the rates of victimization and trauma are particularly high among those incarcerated women. Over 86% of women in U.S. jails have been found to have experienced sexual violence. 77% have experienced partner violence. 60% have experienced caregiver violence. In Harris County, 87% of incarcerated women between the ages of 26 and 35 have a mental health indicator. That means they've either self-reported or jail staff has flagged them as having a mental health issue. If we really want to reduce recidivism, we have to tackle programs that rehabilitate instead of only punishing. And these are the kinds of programs that do that. The $4.7 million reentry program will look like this for a woman entering the Harris County Jail, or the Harris County Women's Center Jail Facility, which is a subset, so to speak, of the Harris County Jail. She will sit down with one of our 8 case managers. They will identify her most pressing individual needs for a successful reentry. That step is crucial. Research shows that individualized attention is what makes a difference in successful reentry and lowering recidivism. The Women's Center Jail will offer these services on a one-to-one basis, which is unprecedented at this scale. After the initial assessment, the woman will work with both her and the case manager and with on-site staff at the Women's Center Jail to match her up with the necessary services. If she needs a place to live, the case manager will set her up with a housing navigator for affordable housing. If she's struggling with drug addiction, they'll work on substance use disorder with specialists on that. Obviously, mental health. Other services include employment services, job search services, identification document service, financial planning. Women will be able to train to be medical assistants, to be work in all kinds of high opportunity jobs once they come out of the jail. Data backs up these initiatives. A wide body of evidence shows that trauma-informed mental health services, which is what we're going to be providing there, has also been shown to lower the risk of reoffending. We are going to also work on these education programs. Research has reported a return on investment of $13.62 for correctional education and $13.21 for vocational education. Now, We do offer some sort of rehabilitative services in the Harris County Jail, but not to this scale. For example, while 30% of the general jail population receives psychiatric medication, only 7% receives any kind of clinical mental health therapy. 100% of the women who need it will receive it in the Harris County Women's Center Jail. Of the $4.7 million, the majority of the funding is going to go to program staff, to grants for providers in the jail to provide these kinds of services. $300,000 is going to go to program evaluation. We want to make sure that this works in case we have the opportunity to continue or expand upon this once the American Rescue Plan funding runs out. The Women's Center Jail, just to clarify, it's a detention facility. It opened its doors in February of this year to hold minimum and medium security women who otherwise would be in the jail. These women are being held for crimes like vandalism, trespassing, disorderly conduct, drug possession, non-aggravated theft, failure to appear in court. The Commissioner's Court at the last meeting approved the funding, as well as case managers who are going to begin working with these incarcerated women one-on-one. The rest of the programming will begin in about 6 to 7 months' time, and the jail, the Women's Center's jail, is already operational. We're going to keep looking for more evidence-based solutions, but I'm very proud of this one. I think it's going to make a huge difference and be a huge model for us, and I trust that it will continue helping us to reduce crime and reduce recidivism in Harris County. Let me repeat briefly in Spanish. Desde que he estado aquí trabajando, hemos invertido en iniciativas inteligentes basadas en evidencia para reducir el crimen en el condado Harris. Y ya hemos sido exitosos. Hemos reducido el crimen un 10% en crímenes violentos este año comparado con el año pasado. Y seguiremos trabajando en estrategias que realmente funcionan en lugar de estrategias que simplemente suenan bien, que de repente la gente quiere que hagamos, pero que sabemos que finalmente no son las más impactantes. Hoy día estamos revelando otra estrategia basada en evidencia. Es una estrategia de $4.7 millones de fondos del American Rescue Plan. Son fondos que hemos recibido con apoyo de la congresista Silvia García, el presidente Biden y el resto de nuestros demócratas en el Congreso, para crear el programa de reingreso a la comunidad para mujeres en la cárcel del Centro de Mujeres en Harris County. La iniciativa del día de hoy ayudará a las mujeres en nuestra cárcel del Centro de Mujeres a reingresar a la sociedad con éxito. Ayudará a las mujeres, pero también ayudará a sus familias, a la comunidad en sí. Un 87% de las mujeres en la cárcel del condado Harris, entre 26 y 35 años de edad, tienen un indicador de salud mental. Eso significa que o ellas o los trabajadores clínicos han identificado un reto de salud mental en estas mujeres. 86% de las mujeres en las cárceles americanas han tenido experiencias de abuso sexual. Un 77% han sido abusadas por alguien en su familia. Entonces, tienen estas mujeres más experiencias de trauma que hay que tratar y que podemos así ayudar a minimizar el índice y la posibilidad de recidivismo. Es por eso que hemos invertido en este proyecto. Cuando una mujer llegue a la cárcel del Centro de Mujeres, la cual abrió sus puertas este año, 2023, en febrero, se sentará con uno de nuestros 8 administradores de casos. Estos administradores identificarán necesidades individuales urgentes para las mujeres para asegurarse de un regreso exitoso, una reintegración exitosa. Los apoyarán con ayuda psicológica, apoyo en encontrar trabajos, inclusive entrenamiento para ser asistentes médicos, para hacer varios trabajos que tienen mucha oportunidad. Trabajarán con ella para ayudarles a encontrar vivienda, habrán navegadores de viviendas, habrán especialistas financieros, todo lo que necesiten estas reclusas, para así apoyarlas al reingresar a la comunidad. Hay muchísima evidencia académica que demuestra que estos programas reducen el índice de cometer nuevamente un crimen. Hasta el día de hoy, la cárcel del condado Harris ha ofrecido programas como estos, pero a un nivel mínimo. En nuestro centro de mujeres, la cárcel del Centro de Mujeres, un 100% de las mujeres recibirán este apoyo individualizado, lo cual es clave para el éxito. $300,000 de los 4.7 millones serán invertidos para evaluación del programa. El resto, la mayoría de los fondos se irán a pagar a los trabajadores y también a ofrecer fondos para organizaciones que proveerán los servicios dentro de la cárcel del Centro de Mujeres. Para clarificar, esta cárcel del Centro de Mujeres ha abierto las puertas en febrero de este año y es un segmento de la cárcel del Condado Harris dedicada un 100% a las mujeres, mujeres de seguridad mínima y media por delitos no violentos como vandalismo, allanamiento de morada, conducta desordenada, robo no agravado y otro tipo de delitos no violentos. Entonces, para concluir, me enorgullece mucho esto, va a ser otro programa exitoso, confío en ello, y le quiero agradecer nuevamente a aquellas personas del gobierno federal como la congresista García que nos han ayudado tanto con esto. También una nota, esta es la primera vez que las 3 mujeres elegidas a la Corte de Comisionados estamos todas 3 juntas aquí en el Condado Harris, todas 3 latinas, entonces con mucho orgullo celebramos eso el día de hoy. Congresswoman Garcia.
Thank you, Judge, and thank you for that historical note, especially since we're on the heels of Women's History Month. And I think that's probably one of the great reasons for doing something like we're doing today to announce the start of this project that will be directly focused on women. Providing adequate mental health resources for incarcerated women is crucial in enabling their successful rehabilitation and breaking the cycle of incarceration within our communities. I want to take a moment to express my sincere thanks and gratitude to Harris County Commissioners Court for their dedication to this cause. Judge, Commissioner, please convey to the other commissioners, the non-women members, that we truly appreciate their support and their vote of confidence in this project. Through their efforts, $4.7 million has been allocated to creating resources for mental health support, trauma counseling, education and vocational training, substance abuse support, and finding housing for incarcerated women. In other words, it's basically wraparound services. It's not just letting them out without any help. These resources will help women successfully reenter society and ensure that they have the tools to lead productive and fulfilling lives outside of prison. Getting people back to work was a key goal of the American Rescue Plan, and this initiative just does that. Remember, we were fighting the pandemic. We wanted to put shots in the arms, money in people's pocket. I know many people got a stimulus check. And then, of course, putting people back to work. This is about helping put women back to work. The decision to allocate these funds towards supporting incarcerated women is a clear example of what can happen when we put people over politics. The $4.7 million, again, were made possible by the American Rescue Plan and President Biden's leadership. So I think it's important to remember that the rescue plan was meant not just help individuals, but it was also meant to keep families together. It was a very critical time. This program certainly will be a big benefit to families in Houston and Harris County. I might add that Harris County in total from this bucket of money received $161 million. So, Judge, we got more money that you could put to use. So it is important that we provide adequate mental health services, and it's not just because it's the matter of justice issue, it's a compassionate issue, it's a human issue, and it's important that we make sure that we have women in the workforce. So again, Judge and Commissioner, thank you so much for inviting me today, and please know that our entire Harris County delegation voted for the American Rescue Plan. We helped fight for it, we got it done. Now we're just glad that it's finally trickling down to our communities to put the money to work just as we had envisioned. So thank you, Judge.
Thank you, Congresswoman, and I know you may have to slip out for another commitment. I'll welcome our Commissioner Leslie Briones, followed by Congresswoman Garcia, and then Chief Vasquez. Commissioner.
Thank you. Thank you, Judge Lina Hidalgo, for your leadership and for bringing us together today. Thank you to the other members of Commissioners Court and to Congresswoman Garcia for your leadership in helping to bring this money home and for inspiring me and so many. So I was happy to be here in this historic moment to have the 3 women who have been elected here. So thank you for your leadership and service. And thank you to Congresswoman Sheila Jackson Lee and the other congressional members who helped make today possible and all of the other ARPA investments. And thank you to Sheriff Ed Gonzalez and Chief Bosques and your team and to everyone at Public Health as well for your work making this happen. This Women's Center reimagines how we can keep our community safe, incarcerate those, and while being incarcerated, poise these women for success upon re-entry into society. How can we reimagine the provision of mental health services, medical services, education, workforce training, so that when the women reintegrate into our community, go back to their families, they are more successful members of society and we reduce recidivism rates. As somebody who has been the victim of crime, as a mother, as a woman, and as someone who used to be a public school teacher, I had many juvenile justice involved youth in my classroom, and many of them came from families where one or more of their parents were incarcerated. If my students' mothers had been at a facility like the one we have launched here in Harris County that provides these holistic integrated services, many of my students would not have entered the system. And this is what it is about, helping to stop the cycle of violence, stopping these multi-generational impacts and keeping our community safe at the same time. So this $4.7 million investment from federal funds will move the needle in keeping our community safer and poising for better outcomes for these women. And it's part of this holistic assessment as to how we're addressing public safety in Harris County. So with that, I look forward to the improved outcomes, to see women come out of this Women's Center so that they can reintegrate, go back to their families, and lead productive lives moving forward. So thank you again, Judge Hidalgo, for your leadership and for our congressional delegation who is making this critical investment. We will help move Harris County forward today and continuing. Thank you. Next, Congresswoman Sheila Jackson Lee.
Let me thank Judge Hidalgo and the Commissioner's Court for a life-saving effort. As the chair and ranking member of the Subcommittee on Crime, I am particularly pleased that we can go back to Washington with my colleagues and talk about the important use of the American Rescue Act. Congratulations to the Commissioner's Court. Glad to see representation from law enforcement and social service advocates. And let me mention all of the Commissioner's Court who work with Judge Hidalgo's leadership to emphasize the importance of where we are today. Over the last 40 years, we have watched the increase of women incarcerated to go up to 834%. 834%, with a much slower pace by men. Most women are involved in criminal activity associated with the particular spouse or significant other that they are engaged or affiliated with. Many times their infractions or violations or criminal actions are of the level that are around fraud and dope or drugs, and also to be, if you will, a co-conspirator to some action that is being done. However it is, they wind up being incarcerated. But women are not just themselves. Women represent families, children. Many of them leave children behind who are pained by their incarceration. Many of them are domestic violence victims, and therefore this amazing investment that the court is making with the very terminology that is so crucial, American Rescue Act. It is to rescue the people and provide them with a greater encouragement. Just taking a quote from an expert on reentry programs. This is the co-founder and executive director of the Texas Jail Project, who says, "We made specific policy changes or choices to get here. We can make specific policy choices to get out. That is what is being done today. Texas being number one in women incarceration. 12,500 women are incarcerated in Texas correction system. 64% of women in Texas correction system were incarcerated. As I said, we're dealing with drugs, and 81% are mothers. 81% of the women incarcerated are mothers. Multiply that by children. And so this program clearly documents and is documented by the House Judiciary Committee that it brings down crime. Reentry, wraparound services to women who want to come back to raise their children will bring down crime and as well provide for a further advancement of these women to be able to move out of the cycle of crime and to be able to provide for their families. Isn't that what a rescue plan is all about? To rescue people from the devastation of their life, from crime, to protect the community from crime. And that is why I want to applaud this court, led by Judge Hidalgo, for the $4 million plus dollars that are going to be utilized specifically for women. Remember the number, 834% increase of women incarcerated. Let's put a stop sign. Let's put a halt on women being incarcerated for these kinds of offenses. Let's take a detour and utilize these resources that the women who are in this program never return to a life of crime. The community is safer, her family is safe, and children are able to grow up with an effective leader at the helm, their mother, who gives them the guidance that finishing school and having an opportunity to give productively to the society is the better way to go. Let the mother be an example through this program. Congratulations. Let us bring down this dastardly number of 834% growth and 12,000. Let's bring that number down and let's reduce crime. Let's support this program and let's congratulate the county commissioners. Judge Hidalgo, I'm delighted to see your leadership with this funding, and I'm sure we will have the opportunity as members of Congress to report back to President Biden and others about this very effective program that just might be utilized across the nation to help bring down crime.
Thank you, Congresswoman. Thank you for your support. And let me introduce Chief Philip Vasquez.
Good afternoon. A little over a year ago, Sheriff Gonzalez brought team members from the Sheriff's Office and together and shared his vision of how we could take a building that wasn't being fully utilized and reimagine it. And with support from Judge Hidalgo, the court, a lot of community partners and other county agencies like County Public Health, that's where we're at today. So we put residents in the facility about 2 months ago, and we're working with, again, community teams coming in, folks in academia, and we know that this is going to be the national model for gender-specific, holistic approach to females being incarcerated in the county jail system. And so we're going to continue to make Harris County be the go-to of where you come to look and gain research and have all these different programs specifically to help rejoin, as Congresswoman Lee said, how do we get these women back to their families? We're going to have innovative programs on how we keep those connections while they're incarcerated, and we're going to return your neighbors back to you in a better state than when they first got involved with the justice system. So we couldn't do it without the strong support from all the county agencies and the leadership under Sheriff Gonzalez, of course. So we just thank you for your continued support.
Thank you. And I do, before we take questions, I want to acknowledge Sheriff Gonzalez. And this is a wonderful partnership amongst so many of us. And so thank you, Chief, and obviously to the Sheriff. Any questions?
Do we have any, I know it opened a few months ago in February, right? Have people moved in already into the facility?
Chief,
Yes,
I'll let you take
yes. We've had them since the end of February. So we've had residents in the facility for the last 2 months.
What are some of the successes that you've seen
We're starting to bring in more of the programs. So our college partners are bringing in programs. We're having trauma-informed classes that deal with yoga and things like that. So we're getting positive feedback from the incarcerated residents already.
And part of what I want to make sure is clear is, it's a jail. The facilities are better, if I might say, Chief, than what's at the larger jail. But the bigger piece of this is what's being built right now, and it's this the 4.7 million, and those programs will be fully operational in about 5 to 7 months. So that's when we'll really see. We're going to have a program manager for the specific program, expert advisors, and then of course our teams working directly on the ground with community nonprofits and organizations that provide that kind of wraparound services, whether it be housing, whether it be school, whether it be financial literacy, whatever it is, drug abuse, but that will not be fully operational for a few months.